Picture this. A calm Wednesday night at the hospital, the clock strikes midnight. The endless labyrinth of hallways stretch out, bathed in a serene glow. The rhythm of routine checks hums in the background, a lullaby for weary souls. Nurses move like shadows, tending to their charges with care. The air is thick with an uneasy tranquility, like the quiet before a storm. Unbeknownst to us, a tempest was brewing in the form of a medical emergency. And then the call came. A patient was having a seizure. The patient, a middle-aged woman, was experiencing an intense seizure. Her arrival at the hospital was marked by a flurry of activity as medical staff rushed to her aid. She was in a state of convulsion, her body racked by uncontrollable jerking movements, a clear sign of a severe seizure. The woman's condition was alarming. She was unconscious, her body convulsing violently, her hands clenched and unclenched spasmodically. Her eyes, though closed, flickered rapidly beneath her eyelids, as if seeing a nightmare that no one else could perceive. The color had drained from her face, leaving her skin a ghostly white, stark against the sterile hospital sheets. As the minutes ticked by, her symptoms intensified. She began to foam at the mouth, an unsettling sight, but a common occurrence during a seizure. This frothing was due to the excessive production of saliva, a result of the muscles in the face and throat contracting erratically. Those present could only watch helplessly as her body continued to convulse, waiting for the episode to pass. Her seizure was a terrifying spectacle, a stark reminder of the fragility of human health. For those unfamiliar with such a sight, it could be easy to panic or feel a sense of despair. But the medical team remained composed, their faces etched with concentration as they monitored her vital signs and prepared to administer the necessary treatment. This seizure was not a fleeting episode. It wasn't one of those that come and go within a minute. No, this was a prolonged seizure, a relentless assault on the woman's body that seemed to stretch on endlessly. It was a grueling 5 minutes, each second punctuated by her violent spasms and the frantic beeping of the monitoring machines. And then, as abruptly as it had begun, the seizure subsided. Her body relaxed, the convulsions ceased, and the foaming at the mouth stopped. The room, which had been filled with tension, exhaled in relief, but the ordeal was far from over. The medical team knew they had a challenging night ahead. The seizure lasted for a terrifying 5 minutes. But those 5 minutes were just the beginning of a night that would test the limits of their skills and resilience. It was time to figure out why our patient was seizing. The key to understanding any medical condition lies in piecing together the puzzle that is the patient's medical history, physical examination, and results from diagnostic tests. As with any detective story, the art of diagnosis begins with gathering clues, and this case was no different. In the realm of medicine, the patient's medical history is our first and perhaps most crucial source of information. It's like the patient's own narrative, a story that can offer valuable insights into their health. In this case, we learned that our patient had experienced similar episodes in the past. These episodes were usually followed by a period of confusion, a classic postictal state which is often seen after seizures. The patient's family also revealed a history of epilepsy in their lineage. This information was our first clue, pointing us towards a potential diagnosis. Next, we turned to the physical examination, the hands-on process of assessing the patient. It's amazing how much a trained eye and a pair of skilled hands can reveal. In our patient, the physical examination was relatively normal, but this in itself was a clue. The absence of signs pointing to other neurological conditions, such as stroke or brain tumors, narrowed down our list of possible diagnoses. Now, to confirm our suspicions, we needed hard evidence, and this is where diagnostic tests came into play. In suspected cases of epilepsy, an electroencephalogram or EEG is often used. This test records the electrical activity of the brain, allowing us to see any abnormal patterns. For our patient, the EEG showed characteristic changes, spikes, and waves that danced across the screen, almost like a frenzied symphony. This was the smoking gun we needed. But our investigation didn't stop there. We also conducted a magnetic resonance imaging (MRI) scan to rule out any structural abnormalities in the brain that could be causing the seizures. The MRI was normal, further supporting our diagnosis. Throughout this process, we also had to consider and rule out other potential causes of seizures. These included metabolic disorders, infections, drug use, and more. But one by one, these possibilities were crossed off our list, and the evidence kept pointing us back to one conclusion. It's important to remember that diagnosis is not just about naming the disease. It's about understanding the patient's condition in a comprehensive way, considering all aspects of their health. It's about piecing together the story of their illness, From the subtle hints in their medical history, to the findings on physical examination, to the results of their diagnostic tests. And so, after a meticulous investigation, the pieces of the puzzle fell into place. The patient's medical history, the physical examination, the characteristic findings on the EEG, and the normal MRI all pointed towards the same diagnosis. After a thorough examination and several tests, the diagnosis was clear: epilepsy. With the diagnosis in hand, we started the treatment immediately. The patient's condition was unique, and hence the treatment had to be equally specialized. The first line of defense in this battle against seizures was a class of medication known as anti-epileptic drugs, or AEDs. AEDs work by altering the electrical activities of the brain, effectively calming the storm of excessive electrical charges that result in a seizure. It's a bit like using a dam to control a raging river, slowing its course and preventing it from overflowing. But it's not as simple as just giving a patient an AED and calling it a day. The choice of medication, the dosage, and the timing all have to be meticulously tailored to the patient's specific needs. For our patient, we prescribed a medication called levetiracetam. Levetiracetam is a newer generation AED, known for its broad spectrum of action and fewer side effects compared to its predecessors. It works by binding to a specific protein in nerve cells, essentially turning down the volume on the electrical activity within the brain. But why levetiracetam, you might ask? Well, every patient is different. Our patient had a history of kidney problems, and levetiracetam is one of the few AEDs that isn't metabolized by the kidneys. This meant we could use it without risking further damage to an already fragile system. It was the perfect fit for this particular patient, demonstrating how vital it is to consider the patient's overall health when deciding on a treatment plan. Next, we had to determine the correct dosage. Too little, and the seizures would continue unabated. Too much, and we risked causing serious side effects. It was a delicate balancing act. We started with a lower dose, planning to gradually increase it while closely monitoring the patient's response and any potential side effects. Timing was the final piece of this complex puzzle. AEDs must be taken at regular intervals to maintain a steady level of the drug in the body. For our patient, we decided on a twice-daily regimen. This would ensure a consistent level of levetiracetam in the bloodstream, providing round-the-clock protection against seizures. But pharmacological intervention was only one part of the treatment plan. We also recommended lifestyle changes to reduce potential seizure triggers. This included maintaining a regular sleep schedule, avoiding excessive alcohol, and managing stress levels. In addition, we scheduled regular follow-ups to monitor the patient's progress and make any necessary adjustments. This treatment plan was not a one-size-fits-all solution. It was a plan carefully tailored to our patient's unique needs and circumstances. It was a plan that took into account not just the seizures, but the patient's overall health and well-being. It was a plan that balanced the urgency of controlling the seizures with the need to minimize side effects and avoid further health complications. The treatment of seizures is a complex and often challenging process. It requires a deep understanding of the patient's condition, a thorough knowledge of the available treatments, and a careful consideration of the potential risks and benefits. It requires patience, vigilance, and a willingness to adapt as the patient's needs change. With the treatment plan in place, we armed our patient with the tools they needed to fight back against their seizures. We provided them with the knowledge and support they needed to navigate this challenging journey. But most importantly, we gave them hope. Hope that they could regain control over their life. Hope that they could live without the fear of seizures. The treatment was underway. The battle against seizures had begun. As the night wore on, we all held our breath, hoping for the best. The hospital, usually a cacophony of sounds, was eerily silent, as if joining us in our unanimous wish for a positive outcome. The patient, who had been caught in a relentless storm of seizures, was now at the mercy of our treatment plan. The first signs of improvement were subtle, almost imperceptible. The frequency of the seizures began to dwindle. From a thunderous storm, they were reduced to the occasional rumble of thunder, a clear indication that the medication was starting to take effect. The seizures, once a fearsome opponent, began to lose their grip. The tight clench they had around the patient started to loosen. The medication was winning the battle, slowly but surely. It was as if we were watching a wrestling match and our team was finally gaining the upper hand. It was a significant victory, but the war was not over yet. The patient was still unconscious, trapped in a world of darkness. However, the brain, a marvel of nature, started showing signs of waking up. The EEG, which had been a jumble of chaotic lines, began to show patterns of normal brain activity. It was as though the patient was slowly but surely emerging from a deep sleep. Then came the moment we had all been waiting for. The patient regained consciousness. It was a slow process, like the breaking of dawn after a long, dark night. First there was a flutter of eyelids, then a groan, and finally, the patient opened their eyes. It was a sight that brought relief, joy, and a sense of accomplishment. The battle was won. The patient was disoriented initially, but as the fog of seizures and medication cleared, recognition dawned. The patient looked around, a clear indication of returning cognitive abilities. It was a moment of triumph, a testament to the power of medicine and the resilience of the human spirit. By dawn, the seizures had ceased. The patient was stable and conscious. It was a ray of hope breaking through the darkness of the night, a beacon guiding us towards a new day. As the sun rose, we took a moment to reflect on the night's events. The dimly lit corridors of the hospital had borne witness to a cascade of events, an unfolding drama that played out under its sterile lights. A drama featuring an unexpected protagonist, a patient with seizures and a team of dedicated medical professionals who came together, like a well-oiled machine, to ensure the best possible outcome. The night had begun like any other, shrouded in the deceptive calm that often masks the storm brewing beneath the surface. But the arrival of the patient, writhing in the throes of a seizure, had shattered that tranquility. The clock had started ticking, and every second was crucial. The urgency was palpable, a tangible entity in the room that spurred us on in our race against time. The patient's condition had presented us with a puzzle, a medical mystery that was as intriguing as it was daunting. The solution lay in the swift diagnosis, which was the result of years of medical training, honed intuition, and the relentless pursuit of knowledge. It was like piecing together the pieces of a jigsaw puzzle, with the patient's well-being hanging in the balance. The diagnosis had paved the way for the treatment, a battle waged with a potent arsenal of medical interventions. Each decision, each step was critical, a delicate ballet danced on the tightrope of medical ethics and patient safety. The treatment was aggressive, an all-out assault on the seizures that had held the patient hostage. And then, the outcome, a ray of hope that pierced through the gloom of the night. The patient's condition had stabilized, the seizures were under control. It was a victory not just for the patient but for the entire team that had worked tirelessly to turn the tide. As we reflected on the events of the night, the importance of quick diagnosis and effective treatment was underscored. The clock had been our adversary, but we had used our knowledge and skills to turn the tables. We had navigated the labyrinth of the patient's condition, charted a course through the tumultuous seas of medical uncertainty, and emerged victorious. The night had also highlighted the role of teamwork in managing such emergencies. Each member of the team had brought their expertise to the table, contributing to the collective effort. We had worked together, like different parts of a single organism, each fulfilling our roles with precision and dedication. But perhaps the most important lesson from that night was the reaffirmation of our commitment to our chosen path. The medical profession is not for the faint of heart. It demands unwavering dedication, relentless pursuit of knowledge, and the courage to make tough decisions. It was a night of challenges and triumphs, a night that reminded us why we chose this path. As I left the hospital that morning, I looked back at the events of the night. A terrifying seizure, a patient teetering on the edge, a desperate race against time, but we made it. With the power of medical knowledge and sharp thinking, we navigated the storm and brought our patient back from the brink. It was a testament to the life-changing potential of medicine. It was a night that reaffirmed my faith in medicine, a night I will never forget.